I don't normally talk about the national scene and the national level, but I got to say something about something that the administration, a couple of things the administration has just done. And I want people to think about how these things fit together. We know that the president's been pushing everybody to go back to school, despite the fact that we know the kids are as active spreaders and capable of spreading as adults, despite the fact that we know that their infection rates are going up and the data shows it. He's insisting they all go back to school. Then on top of that, yesterday we find out from FEMA that as of September 15th, FEMA will no longer reimburse school systems for masks for children, which means that A, these masks on mass scales are not cheap. They do not last perpetually, so they continually have to be replaced. So basically, they're going to undermine the ability of kids to protect themselves in school, which means that since these kids come from diverse neighborhoods all over the place, Montgomery County is a great example of that, you are likely to get cases brought into school. You are likely to encourage the spread of disease in school if the kids aren't wearing masks. And then to top it all off, he wants to cut down on non-symptomatic testing, which means that you couldn't even test these kids to see if they were carrying, if they weren't symptomatic, which means they will be able to spread. And the people who they spread to will not get tested until somebody gets a fever, a sneezing, and is deemed to be worthy of getting tested. This goes beyond neglect. It goes beyond regular carelessness. This is actually a set of actions which is going to endanger the communities in this country, and not just Montgomery County. I assure you, we're going to continue to try to make sure we can get masks to the people who need masks. When the schools are ready to be open, we're going to make sure that the supplies are there. Hopefully there'll be saner people in charge when we get to that point. People ought to put 1 + 1 + 1 together. It's almost like they're trying to drive this notion of herd immunity, that if I can get everybody sick, then the herd gets immunity, and if some people die, oh well. I don't have an oh well approach to whether or not some people die. I look at any death as an unfortunate and probably something, at least a large number of which could have been prevented. So I'm very disappointed with what's happening at the national level.